how has the business been able to move from country to country? So it started in Tunisia.
Yeah.
How did it go into all the other African countries?
Yeah, we started in Tunisia in public hospitals and private hospitals.
Okay.
And then we moved to North Africa markets like Algeria, Libya, and Morocco. This is our the first markets. And now, since 10 years, we are developing our international vision. And we need to look for partners in each country.
Okay.
For example, we are present in Nigeria since around
Yay!
5 years. Yeah, Nigeria is a good country.
Hey guys, welcome to How They Did It with TriciaBiz. On this show, I take you behind the scenes of successful African entrepreneurs, change makers, and creators, showing you the journeys that led to their success.
I'm Emna Guirat, the Deputy CEO of Sofemed from Tunisia. Welcome to the show.
Okay, so I'm with Emna Guirat of Sofemed. It's so good to have you on the show.
Thank you, welcome.
Thank you for having us here in Tunisia.
It's nice to receive you.
Fantastic. So let's talk about the business. So I understand it is your family business.
Yeah, the Sofemed was established by my father in 1995.
Okay.
And at the beginning, it was a surgery that my mom made in a Tunisian hospital. The products of Sofemed are orthopedic implants aimed to heal fracture, bone fracture in all the body of the human.
Okay.
So my mom used an implant, and my father had the idea.
Okay.
My father was a businessman in other kinds of factories and business, and he got the idea of making a Tunisian implant and a Tunisian solution for orthopedic surgery.
Interesting. So your mom had to do a surgery.
Yeah.
Great. So how is she doing?
She's okay.
She's okay. Fantastic. So he had this idea. How did he then take it from idea to execution?
Yeah, he starts with prototype, a good prototype, and show it to Tunisian surgeons. And a group of Tunisian surgeons were very interested in the idea.
Okay.
And we gathered all orthopedic surgeons, specialists, to establish Sofemed, to make the first prototypes, to make studies for the local market, for the international market, and for medical standards and for medical devices.
Okay. So it started in 1995. How has the business evolved? Like, how many products did he start with, and how did you keep adding products until we have all the products you have now?
Yeah, he starts with a few machines. Now we have a factory, and we are moving to a new factory in a few months. The factory according to standards and to new machines. Sofemed was facing a lot of steps, technical steps for the development of the devices, regulatory steps, market steps, market problems. Now it's okay, and it looks for future. We need to prepare our strategic vision for 30 years, for example, to make Sofemed sure, to make it to be sure to face new challenges and future challenges for international markets. We are operating in more than 30 countries around Africa and Middle East and a few countries in Europe. So we need to make sure that we are well prepared for these international challenges.
Okay, so how has the business been able to move from country to country? So it started in Tunisia.
Yeah.
How did it go into all the other African countries?
Yeah, we started in Tunisia in public hospitals and private hospitals.
Okay.
And then we moved to North Africa markets like Algeria, Libya, and Morocco. This is our the first markets. And now, since 10 years, we are developing our international vision. And we need to look for partners in each country.
Okay.
For example, we are present in Nigeria since around 5 years. Yeah, Nigeria is a good country, is an interesting market, and we have there a new partner. And next month, by the end of November, we'll be attending the Nigerian Orthopedic Congress.
Okay.
With our orthopedic solution for Nigerian and regional surgeons there.
Okay, so how have you or how has the business been able to drive market penetration? Because there are foreign companies who do all of this.
Yeah.
So what marketing or what solutions have you been able to put on the table for them to take an African product?
Yeah, it's not easy. We have to give solution for technical features, for regulatory and standard features, for a clinical solution for the surgeon. Each surgeon he will ask for details or for specification. We are working on the price. Our solutions are competitive, but we need to assure the best quality and the best raw material, medical raw material. So price are competitive, but not cheap. So this is an issue that surgeon needs to be aware of this.
Okay.
We need to propose an African solution, Tunisian solution, according to international standards.
This is me interrupting your watch time to tell you to like this video, share it, and also subscribe to my channel. You're still watching How They Did It with TriciaBiz.
Okay. So how has it been tough getting like regulatory approvals to get your product into all these countries across Europe and Middle East?
Yeah, now, for example, Nigeria, we are making regulatory registration in the Nigerian NAFDAC, yes. So we prepared the whole technical file with documents, with company documents and product documents. And with our new partner in Nigeria, we are making the registration procedures to be sure that our products are available according to Nigerian law. A lot of countries in Africa are making the same steps, the same procedures with the Ministry of Health in each country.
Okay. What challenges has the business faced, either here or internationally?
There is European competition, Asian competition, and we need to improve and innovate constantly our implants
Okay.
to be sure to have the new techniques, surgery techniques, and give the best surgery implants or tools for the surgeon. Okay.
Okay. So if I hear you, the major challenge is staying competitive
Yeah.
because there are other Asian and European companies who are also producing the same. So if I ask, why should I take Sofemed's products and not the Asian products?
We are an innovative company.
Okay.
Our solutions are developed with African and with Tunisian surgeons, and we have very good surgeons, orthopedic surgeons. In Tunisia, we have more than 4,000 surgeons,
Okay.
orthopedic surgeons. So all our devices are developed with surgeons, and each one can give the idea and the innovation, and we are transforming this innovation in final product.
So how many products does the company produce every year?
We have a range of products for more than 3,000 kind of products.
Oh wow!
Yeah, and
That's
we
a
are for screws, for example, we are producing hundreds and hundreds of screws each year.
Okay, hundreds of thousands.
Yeah.
Okay.
Hundreds of thousands. Yeah.
Interesting. How profitable is this business?
It's enough profitable to make sure that Sofemed will be there
for many years to come.
30 years or 50 years.
Okay, so how is it for you working in your family business?
I start with working in Sofemed from the end of my studies.
Okay.
The beginning is as a trainee.
Okay.
And I was in the financial department, in the accounting department, in sales department, then in production and in R&D department. This is the family affair, so I have Mr. Emna Guirat is my brother. He's the CEO of Sofemed.
Okay.
And we are working together with our team, our Tunisian team, engineers and technicians, to make sure that Sofemed is working. There is a lot of challenges, human challenges, financial challenges, and market challenges in Tunisia and in international markets.
So what's the long-term plan in 10 years? Where will we see Sofemed?
We are hoping to see Sofemed more in Nigeria, in hospitals and private clinics.
Okay.
And we are moving to Morocco and to Kenya.
Okay.
This is the plan for the next years. For some country, we are looking for partners, and for Kenya and Morocco, for example, we are looking for Sofemed subsidiary there.
Subsidiary.
Yeah,
Okay.
subsidiary there to be sure to be the next the Kenyan markets and patients, for example.
Okay, so finally, what advice do you have for businesses that are trying to survive in Africa and looking to scale out of Africa?
We need to have a good team with us
Okay.
to go international. team looking for the best solutions for our customers.
Okay.
Team looking for giving advices for the final customer, for surgeons and for the patient. We need a very good team with us, and we need financial assets. It's very important in Africa or in other countries. And strategic vision is very important for a company to know the way, to give the way for the customers and for the team, the way chosen by the management or for the company for its development.
Okay. Thank you very much for having us.
Thank you. Welcome.
All right. And that's it, guys. I'll see you on the next episode of How They Did It with TriciaBiz.
We are here in the factory of Sofemed. We are established since 1995, and here is the first part of our factory. Here all the machines are CNC machines ordered by computers and automatic machines for the manufacturing of medical devices according to international standards.
Okay.
You can see here the first one. This is the first CNC machine ordered by computer. It's full automatic and it's aimed to make transforming the raw material into final product.
Okay.
And the final product here is the screw. It's a screw like this.
Okay.
This is a medical device. This is a final medical device.
What is it used for?
Used for osteosynthesis treatment for surgery. It's for bone fractures and for orthopedic surgeries.
Okay.
So all kinds of products is manufactured here according to international standards.
Okay.
And our raw materials also is according for international standards.
Okay.
Sofemed is operating in Tunisia, but also in more than 30 countries around the world.
Okay.
In Africa, in Middle East, in Nigeria, in Chad, in Cameroon, in Senegal. And we are reaching new countries like Kenya, like Ethiopia, and like Rwanda. Our solution is very appreciated in Tunisia in public hospitals and private hospitals.
Okay.
And we are going with doctors, with surgeons around the world and around Africa to give them the best orthopedic solutions, the best medical devices with the best price and according to international standards.
Okay, so is it a Tunisian company?
Yeah, it's 100% Tunisian companies.
Okay.
With Tunisian employees, engineers, and with the assistance of Tunisian surgeons.
Okay.
All the products, all the devices are developed with surgeons, with Tunisian surgeons in orthopedics.
Okay.
Both machines, but making the same, almost the same steps. Some products are manufactured full automatic in this machine, and some products needs to make steps in all these machines.
Okay.
Which
product is here?
Here we are producing wires for orthopedic surgery.
Okay.
We need this to be implanted in the bone and to fix fractures, bone fractures.
Okay.
And this is the step realized here to make the extremity very sharp.
Okay.
Okay.
Wow.
We are producing thousands and thousands of wires per year. Maintaining all tools needed for the machine.
Okay.
All tools used to make the final product. Okay.
Okay.
This is our raw material warehouse.
Okay.
All the material here is placed according to its characteristic and kind of materials,
Okay.
and labeled with colored labels to make sure to differentiate
them.
them.
Okay.
This is the materials we use for medical devices. Now, for orthopedic implants is stainless steel. It's medical stainless steel according to standards. It's medical titanium.
Okay.
Okay, and we can see here our procedures for the warehouse. White label is stainless steel, and yellow label is titanium.
Okay.
And always according to ISO standards.
Okay.
ISO for stainless steel, ISO for titanium, and other raw materials here for tools or for non-implantable devices.
Okay.
So the yellow part is titanium.
Okay.
We use bars and sheets like this, for example, to produce implants, to produce screws and nails, plates, or and instruments also, all needed for orthopedic surgery.
Okay. So where do the raw materials come from?
From international suppliers.
Okay.
According to our procedures, and from Germany and from China.
So no raw materials are got in here?
No. This is medical raw material, now available in Tunisia.
Okay.
We have stainless steel from Germany and titanium from China. China is the biggest producer of titanium in the world.
Yes.
اي تخوي يصير بعض البلياج. لا حل لنا خلينا نشوف. اي حل دو بورت شو عندك فيه؟ حل مليح.
Oh wow. What is this milk?
Milk. It's a lubrificant liquid.
Okay.
For lubrication and to make sure that the stainless steel is not hot.
Okay.
With the tool. The tool is turning there. So there's a lot of friction with the stainless steel. It could be hot. Okay.
So what device does this machine produce? This one?
Yeah, this machine is full automatic CNC machine with computer specification, yes. And it produces this kind of plate of device. And here it's changing automatically the tool.
Okay.
It takes the second tool and proceed to the second step. Okay. The steps are detailed here in the technical file. Technical file, we have the drawing of this piece with technical specifications, with here lengths and holes, number of holes. All technical specification is here, and the operator here is following the file, and he's registering all parameters of production here and making auto control. All pieces are controlled. The raw material is controlled, quality control. The operator makes quality control, and we have a final department of quality control. قلهم يخليوا ضوء يشعل بربي أنا جينا. اوكي اي الكنترول كلهم استنونا اوكي this is a tool to make
Quality control.
to make checks and quality control and he is using this to make measures all the tool to measures all specification detailed
Okay.
on the drawing
Okay.
and we need to follow all steps detailed here and for each piece thank you واللي نحكي مع بعضنا thank you for each piece we are making a lot of registration to be sure that the quality is respected of the process of production.
Okay.
Merci Monique. نمشيو we have the quality control department here. This is quality control department
Okay.
and we are making control on each part of the device. As
What are the controls put in place?
we are عسلامة.
And if you want
Actively
one of them to
control,
speak, they can
Brabinta.
speak in French and then we will translate.
French?
Yes. So if you want them to talk, or if you want
no,
to speak for
they
them.
can speak in French.
Okay.
In Arabic?
No.
أعطيني. به. Here the final control of wires. Wires as we see
Earlier.
in the machine there.
Yeah.
Okay? The wire is like that.
Okay.
The sharp wire. And she makes three kinds of control. Dimensional control, technical control at specifications, and visual control
Okay.
to make sure.
So technical,
Yeah.
visual, and what else?
Yeah, technical as requirements,
Okay.
visual, and dimensional.
And dimensional. Okay.
Okay. This is the same tool that operator is
Uses
using
to check. Okay.
to check dimensions. This is also a tool and a calibrated tool. As we see here, the calibration of the tool.
Okay.
Okay? All tools are calibrated and she makes sure that the length of the wires are the same.
Okay.
Okay?
So how long does this take? Does she check everything or just some items?
Piece by piece.
Oh wow.
Yeah, final product is piece by piece.
Wow, that's a lot of work.
The medium control by the operator is by samples.
Okay, just pick a sample from the batch.
Pick samples. He has one sample from 10.
Okay.
He needs to check the dimensions. And the raw material is also checked piece by piece. Huh?
Piece by piece.
Yeah.
Wow.
عندك بروش زيادة؟ Okay. This is final product of wires.
Okay.
قديش الدوسي فيه هذايا بربي؟ كوثر. Le même dossier? 22,000. Here the batch number contains 22,000 wires. Yeah.
Controlled one by one.
Yeah. 22,000.
Wow.
Okay.
How long will it take to control that 22,000?
A few days.
Few days.
Yeah.
Okay.
Okay.
So once it's controlled, where does it move to?
Moves to packaging and labeling.
Okay.
Okay. أعطيني سال بلانش بربي محلولة. This is machines for some quality controls. We make them here, and some others we make them in French or German laboratory.
Okay.
Because machines are more sophisticated.
There.
Okay. This is to test the strength of the raw material and the strength of the final product.
Okay.
The clean room. The clean room where we are making the final packaging of cleaned medical devices.
Okay.
Our medical devices are sold not sterilized. Sterilization will be made in the hospital and in the clinic
So it's sold on
before the
sterilized.
surgery.
Okay.
Okay. But all our devices are cleaned with procedure and specification and packaged here.
Okay.
Okay.
What does the final packaging look like? Like this?
Final package is like this, yeah.
Okay.
Package for sterilization with instruction of use here for the surgeon.
Okay.
All products, piece by piece, are sold with instruction of use.
Instruction.
Okay.